Welcome to Feeling Good Feels Good. I am your host, Dr. Tripp. This is the podcast where we take nutrition and medical advice that once felt complicated and make it simple and applicable for you. We also look at simple, everyday items and habits and find the wonder, the history, and the benefits in those. Today, we have an episode about something that we all share. Have you ever tried to reach over your head and you feel a pinching in your shoulder? You ever reach behind you in the car to try to find something in the back seat and it feels like your arm goes numb? Those all come from the same thing. It's the rotator cuff. The rotator cuff is one of the most common injuries that people experience, and it's a shared experience between athletes, desk workers, labor workers, parents, youth sports participants, and even the older population. Is one of the parts of our body that's most suspect to injury. But when we learn about all of the amazing things that the rotator cuff does, it makes sense why it becomes injured so often. But don't worry, today we're going to talk about how to know if you are suspect for one of those injuries and how to deal with it, recover from it, and heal the rotator cuff itself. Not to mention, I'm going to tell you what the rotator cuff actually is. So with all of that, let's dive in.
Welcome to Feeling Good Feels Good with Dr. Tripp.
Welcome to a state of feeling good. It's how we live and how you could. Just know it's how we're all meant to be. If things are off, listen to your body. It can tell us exactly what we need. Physical, emotional, nutritional, or mentally. No need to worry, it's reached accessibly. No matter how you felt or what you've heard, well-being's for everyone, it's what you deserve. Ease and joy are yours once it's understood. No need to fear, because feeling good feels good.
The information in this podcast is intended for educational and informational purposes only. It is not medical advice and should not be interpreted as a diagnosis, treatment, or prescription. Listening to this podcast does not establish a doctor-patient relationship. Always consult your own healthcare providers before making any changes to your health, medications, or treatment plans. The opinions shared here are based on clinical experience, research, and professional knowledge, but they may not apply to any specific situations. By listening to this podcast, you acknowledge and agree to these terms.
Welcome back to Feeling Good Feels Good. I'm so happy that you are all here. Today we're going to talk about a part of the body that we all have to deal with and we all have to use in our daily life no matter what. Let's start with the word rotator cuff. What does that actually mean? So cuff implies a sleeve. Basically, the rotator cuff makes a sleeve for your arm bone. This cuff protects and controls so much of your shoulder joint, and the shoulder joint is extremely unique. If you think about your elbow, you can flex it and extend it. If you think about your knee, you can flex it and extend it. If you think about your shoulder, you can reach it, turn it, lift it, push it out to the side, reach behind you, or do all sorts of different movements with the shoulder. It's literally a ball in a socket held together by all of these different muscles, the most important of which are known as the rotator cuff. So the rotator cuff is not one thing. It's actually a category. The rotator cuff really just categorizes very important muscles, and it's made of 4 muscles. Don't worry if you've never heard of these. We can just continue calling it the rotator cuff, and that's totally fine. But they're referred to as the sits muscles: supraspinatus, infraspinatus, teres minor, and subscapularis. When you ask people about what makes us different from primates or what contributed to evolution, so many people talk about the opposable thumbs and the ability to walk upright. And yes, those are important, but we cannot overlook how the rotator cuff was an important part of human evolution. The rotator cuff basically developed into a group of muscles that were more high-tech and were crucial for early survival. Imagine it's 2 million years ago and you're an early human trying to find food to survive. You see a bird in a tree and you reach for a stone or a stick to catch it. You need to throw it and throw it with power and precision, and your shoulder goes through a big range of motion, transferring energy from your torso through your arm all the way to your hand. and doing all of that without your shoulder popping out of place. Remember, your shoulder is literally just suspended in air. It's a very unique joint. This is all accomplished due to the amazing ways that our rotator cuffs work. And it's not even just survival on the ground. Think about how people learn to climb trees to escape from predators. Imagine hanging from a branch without your rotator cuff being strong, stable, and mobile. Your arms could not tolerate it. Either they would fall out of place or you wouldn't be able to propel yourself up to the next branch. Then there's tool making and tool using. Pounding, scraping, twisting, you name it. Making and using tools required controlled rotation and fine motor control. All of these movements continued to put our rotator cuff to work, stabilizing our shoulder joint while giving our arm precision and strength. Fast forward today, and your shoulder is still getting the job done. Maybe it's not as high risk or as strenuous, but you still have to reach for a steering wheel, hold your arms while you type, reach up in your cabinet, wash your hair, throw a ball, do a push-up, or even lift a backpack. The design of our shoulder to give us both stability and freedom of movement is so crucial to how humans operate in the world today. It seems simple, but it's pretty crazy to think about. Without the rotator cuff, we would not be where we are today, and this developed of a society and a culture. Yes, rotator cuffs helped advance society, and while I'm saying all these things, you might already be thinking about people who maybe have the most advanced, or the strongest, or the most precise rotator cuffs. Think about people like Serena Williams or Tom Brady, who can control their shoulder movements with exact precision, strength, and timing, or even musicians who are able to hold instruments for long periods of time, sustaining support while communicating complicated musical patterns from their brain through their muscles to their hands. Having a functioning rotator cuff is one of the things that we look for in our office on a regular basis. Oftentimes, it can be the source of other issues and other symptoms, and in the past may be overlooked. Because the rotator cuff does so much for us, it can easily become fatigued and overworked, especially if the movement patterns that we do in our day-to-day life put disproportionate strain on one part of the rotator cuff, but not the other. Think about that burning feeling in your shoulder when you've used it for too long, or that pinching sensation when you reach overhead that makes you shake your arm out. Your body will start to try to avoid these movements. It remembers that burning sensation. It remembers that pinch. It remembers that muscle spasm or that strain you feel when you reach for something far above your head or behind you. Maybe you're typing at a computer or using your hands and your shoulders become tired, but you still need to get the job done. In all of these cases, one of the most common things that happens is your body compensates with the muscles of your spine. For those of you who are listening and not watching, I want you to try to visualize this. Think about reaching up and using your shoulder. Think about the outside part of your shoulder, the part where your arm connects to your torso. You use that part of your body to lift your arm. When that gets tired and you need to reach, your body is still going to make that reach happen. Now, it might start to recruit muscles of your spine and your neck. So rather than just lifting your arm, you're leaning to the side and lifting your whole torso just to get your arm up. Over time, the strain that this puts on your spine can lead to things like neck pain, headaches, even cause imbalances that lead to jaw pain, TMJ, or even rib dysfunction. So many patients are so surprised to learn that the source of their neck pain and their headache is coming from long-term compensation from an old shoulder injury. Maybe it was 2 years ago, maybe it was 10 years ago, or maybe their job just requires them to move a certain way that is shutting down their rotator cuff and putting too much strain on their spine and their neck. Now, some of you may hear the word rotator cuff and automatically think about a major injury. This absolutely does not have to be true. Think about your ankle for a second, one of the most commonly injured parts of the body. You can have a slight ankle sprain, a slight tweak of the ankle and the ligament, or you can have a fracture in multiple places. So just because we're talking about a rotator cuff, it does not mean that you're requiring surgery, requiring slings, or even needing a long time to heal the issue and remove the dysfunction. And let's just think about the word tear for a second. When you go to work out and when you're lifting weights, what are you doing? You're literally tearing your muscles apart so that they can come back stronger. So just because you hear the word tear, that also does not mean major injury. So you could hypothetically hear that you have a rotator cuff tear and you could be practicing your favorite sport just within a couple of weeks. There are degrees of tear and there are degrees of rotator cuff injury. And unless you have a grade 4 tear, some grade 3 tears, if there's other compromised part of the shoulder joint, like a labral tear, usually it can be corrected through conservative care like PT, chiro, and acupuncture. And even in those people who have grade 4 tears, labral tears, some of them decide not to move forward with surgery. Now, that is a very case-by-case thing, and there are many cases where I absolutely recommend getting a surgery, and some where I encourage the patient to try conservative rehab first. And many where we just know this is not going to require surgery, or surgery is not an option. Parents or people who travel for work, have you ever tried to reach behind you for a backpack, a toy, a water bottle, and you feel that pain in your arm that makes you drop your shoulder really quickly? That can be a slight tear or even impingement of your rotator cuff. Another common way that the rotator cuff gets injured is not just through tearing, but through something called impingement. In the front of our body, we have our collarbone, our clavicle. So remember, collarbone, clavicle, C. You can touch your collarbone and feel where it is. It goes from the outside of your shoulder all the way into your sternum, your chest bone. So C, clavicle. On our shoulder blade, we have a little hook on the back of the shoulder blade. That is called your acromion process. It is a little hook that starts on your shoulder blade and hooks over to attach to your collarbone in the front of your shoulder. That is called your acromion process. So acromion and clavicular or acromioclavicular or AC joint. You may have heard of your AC joint. That is your collarbone meeting your shoulder blade. I'm bringing this up because the joint itself can become sprained, similar to an ankle sprain. It can also have partial or complete separation. These bigger injuries, these bigger separations may require wearing a sling for a longer period of time or even sometimes surgery. You can notice people who are prone to these shoulder separations and shoulder dislocations by looking for something called a step defect. I actually have one on my left shoulder. You can see a bump that looks like a step. This is known as a step defect. One of the most famous people that I see who has very obvious step defects is the basketball player Kawhi Leonard. If you watch basketball next time, look at his shoulders on both sides. He has giant step defects on both sides. If you followed his career, you know it's full of injuries. Those step defects are just a sign that somebody may slightly dislocate their shoulder from time to time or has a history of shoulder dislocation. So just because I have a step defect does not mean my shoulder is dysfunctional. In most cases, it's purely just a cosmetic thing. It's just a visual reminder that at one point you dislocated your shoulder. Now, the other reason that I want to bring up the AC joint, remember, acromioclavicular, where the back meets the front, is there's actually a small space between these two bones. And between these two bones, the rotator cuff muscles have to pass through. So what happens there? You can probably already start to guess it. That space gets smaller and those muscles get inflamed and everything just becomes jammed up and pinched. That is known as impingement syndrome. Basically, your rotator cuff muscle is just getting pinched between your AC joint. And that's what I'm talking about when you may have the sensation of reaching overhead, reaching in front of you, lifting your drink, or whatever it may be, and you feel pinching in your shoulder that makes you quickly drop your arm. Super common. In most cases, this is treatable by correcting posture, movement patterns of the shoulder blade, and reducing rounding of the chest, thoracic spine, and ribs. This way we can create more space between the collarbone and the shoulder blade and heal the muscles so that they are not so inflamed. Again, a super common issue. This one is more directly felt in the shoulder. So if you have pinching with reaching or lifting overhead, that's likely impingement, and we would need to get your posture corrected, heal the muscles, and correct range of motion. Now remember, there is a scale. There can be minor injuries to major injuries. Some injuries may take 0 to 2 weeks to heal. Some injuries may take 0 to 2 weeks just to start to feel less pain. For new or acute rotator cuff injuries, I usually want to see this person fully healed by 12 weeks at the most. If it's a chronic issue or something that's been there for a long time, it may take a little bit longer, and that's okay. So don't be discouraged if you've had chronic shoulder pain and it's taking you over 3-4 months to get rid of it. You may be just knocking at the door of freedom of movement, freedom from pain, and more strength and coordination. Now, if I look at the healing of a rotator cuff or the correction of a rotator cuff, maybe you don't necessarily have an injury, but you're just trying to improve your biomechanics, improve your strength or coordination, or perform better at sport. I tend to look at this as 3 levels. First, we need to be able to make sure the joint can move comfortably without pain. That is the first step, is addressing, assessing, and improving mobility. Can I move the shoulder joint? Remember, this joint is very unique because it's not just bending, it's holding a bone that's basically hanging on its own and controlling all of the movement and coordinating all the movement, stabilizing the joint and delivering precision. So this one is something that may take you a little while or may just be a fun puzzle for you to figure out. But can the shoulder move through ranges of motion without pain? Next, I want to look at strength. Can I move through these ranges of motion under stress, or with a weight, or with a band? Getting to this stage is key. There's probably going to be some pretty good health and integrity in your shoulder joint and your rotator cuff if you can move through the ranges of motion with weight or with resistance or under some form of stress. And the last stage, if you're trying to get like Serena Williams or Tom Brady, is neuromuscular coordination. We want to do neuromuscular reeducation and timing. These are training patterns that increase coordination, spatial awareness, balance, and the speed with which your brain, nervous system, and muscles all communicate information back and forth. When you get to this level, I really think nutrition plays a major role. Micronutrients, macronutrients, but also lots of omega fatty acids can expedite or speed up the way that our nerve cells communicate with each other. So when you're getting to those higher level performance outcomes and goals, it is important to incorporate higher level nutrition. This is going to be very person dependent, and we usually do functional medicine testing to see how we can optimize the way this person performs. But a general rule of thumb is I want to see lots of omega fatty acids, fish oil, raw olive oil, fish, avocado, walnuts, ground flax seeds, those types of things that are really healthy for producing myelin, which speeds up the communication between your nerve cells. So if you've experienced shoulder injury, you're curious about improving the function of your shoulder or becoming better at your sport or your passion, it is absolutely possible, even if you've had chronic pain for long periods of time. And remember, it may not be from your shoulder directly. You may experience neck tension and headache and neck pain that are a result of your shoulder injury. Visit a PT, a chiro, an acupuncturist, somebody who's familiar with this stuff, who has good reviews and has a good reputation at helping people, because this is fixable. If you're working on it at home, start with mobility, progress to strength, and then progress to coordination and neuromuscular re-education. I hope you all feel a little bit better about understanding what's going on in your shoulder, seeing how important it's been, not just throughout your life, but throughout the course of human history. And I hope you feel more motivated to handle it on your own or to ask for help and know that you can get better. I can't wait to see you all next time on the next episode of Feeling Good Feels Good.